Are you pregnant and dealing with hip flexor pain or pain in the front of your hips? Try these exercises out. So often when you're pregnant, we've got the weight shift from the belly pulling you into that forward tilt, or what we would call an anterior tilt, where your back's more arched, your pelvis is tilting forwards. So that can be because of tightness in your hip flexors. It could also be tightness in your quads, and also even the shins can contribute. So I want to show you how you can stretch out and foam roll those muscles to try and reduce any tension. We all probably know the good old quad stretch. So you're going to come and use a wall, try and bring your heel to your bottom and press your hips forward. Now to increase the stretch, try to tuck your tailbone or flatten your back and push your pubic bone forwards. Generally, I recommend to hold these stretches for about 30 seconds on each side before swapping. To stretch the hip flexors, we can come down onto the ground. You're going to come into a runner's lunge or a kneeling lunge. So again, coming into that lunge, sitting up nice and tall, try and tuck your tailbone. And for me, I get that stretch immediately, and a lot of people will. If you need more, you can lean into it. Just try to avoid arching through the back because you'll completely lose the stretch there. And if you want to increase the stretch, reach down to the floor and extend the opposite arm up and over. And we'll hold these stretches for about 30 seconds on each side as well until moving on. And sometimes you might find one side is more tight, so just spend a little bit longer, maybe do a second stretch on that side that's more tight. Stretching your shins is a little bit more challenging. Some people will get a stretch just by sitting back down onto their heels like this. And if you do, that's great. You can try this one, and again, holding for about 30 seconds to a minute. But if you struggle to get the stretch like I do, I'm going to show you how you can foam roll your shins and your quads. So to foam roll your shins, you're going to come onto the foam roller, pop your hands on the ground, and from here you're going to pull forward and back. Now because your belly is probably going to be in the way, you're going to need to split up doing the top half of your shins and then move the roller down to then do the bottom part of the shins. Now I can feel my core working as well when I do this one, so it can be a nice core exercise, but if you are having any doming or pressure in your tummy, you can try doing this down on your elbows, and that might take a bit of the pressure off. We also want to get the outside of the shin too, so just cross one foot over the other, lean over to that side and just try to roll out the outside a little bit more. Do that on both ways, and we'll do that on both sides. Okay, to foam roll your quads, you're going to come down onto your elbows, place it just above your knee and roll yourself forward and back. And then again, moving to that middle third of your thigh, rolling forward and back, and then up a little bit higher into the top third. Again, with this one, you want to roll to the side a little bit to get the outside of the thigh. That's often the spot that's the most tight. So just doing one at a time there. So along with the front of the body being tight, we often find in hip flexor pain that the back of the body is not activating very well. And that can be because of that weight shift forward too. So I want to show you some activation exercises for the backs of your legs and for your core to try and help improve your posture. Okay, so we started by foam rolling our shins. Now to activate the muscle on the opposite side, it's our calves and our feet. So the most simple exercise, nice and easy, is some calf raises where you're just coming up and down onto your tippy toes. So you can do that double leg just like this, or coming onto one leg and repeating that on both sides. So you want to do that until your muscles are fatigued. So for a strength training and really trying to focus on building the muscle, you want to repeat that 3 times through. All right, the next one, so we foam rolled the quads and now we want to activate the hamstrings. I'm going to show you 2 ways to do it depending on how far along your pregnancy you are. So if you're in your first trimester, and we can be a little bit lenient up to about 28 weeks here because you are still allowed to sleep on your back until 28 weeks, you can come down onto the ground and do some bridges. So lying on your back, heels on the ground, hands on the ground, dig your heels into the floor and try to peel your spine up off the mat, dig your heels down and try to pull yourself over your knee, so reaching forwards, and that should help to activate your hamstrings, and then rolling back down. So you're going to repeat that between 8 to 12 times depending on how it feels, and have a break in between completing 3 sets of that. If you're past 28 weeks of pregnancy or it doesn't feel good to lie on your back, we're going to do our hamstrings with some deadlifts. So you're going to come with your feet about hip width apart, hands on your thighs, bend your knees slightly, and then tip and lean forwards from your hips, hinging at your hips until you feel that hamstring stretch, and then press straight back up from there. So always keep a slight bend at the knees, hinging forward from the hips, making sure we're engaging the core as we go down. If you'd like, you can hold on to a weight or a kettlebell to increase the resistance. This can also be done on a single leg, which will challenge it a little bit more. So single leg deadlift, up and down. Of course, doing that on both sides. 8 to 12 reps, 3 sets with a break in between. Just be mindful with the single leg that you're not getting any pelvic pain. So if you are, just go back to double leg. And then finally, we want to work on engaging the core. And the reason for that is when you are in that forward tilted position, the abdominal muscles are on a big stretch and they're unable to activate very well when they're on that big stretch. So we're going to focus on engaging through the core and getting our back into more of a neutral position. So I think one of the best ways in pregnancy is to come down onto all fours, hands underneath shoulders, knees underneath hips. We can simply start by just relaxing the belly and then drawing it in. And then holding there, we can do one arm reach, alternating sides. If that's too easy, you could extend one leg at a time, trying to keep your back really still. And then if that's easy, then we can go for that Superman, opposite arm to leg. So just make sure as you do that you're keeping your belly button drawn to your spine. And finally, the last thing I'd recommend is to think about your posture day to day. So it's all good and well to do these exercises maybe once or twice a day for 5 minutes, but what you do and how you stand for most of the day is going to be more beneficial. So as I said at the start, we're in that anterior tilt or that forward tilt. So we're really focusing on tucking the tailbone, pulling the core in and flattening out the back. We don't want to be completely flat, but we want to find that middle ground. So try to remind yourself through the day, maybe set a timer on your phone every hour just to check in with your posture and focus on that. And you can try some pelvic tilts as an exercise as well, either sitting on a fit ball, sitting on a chair, sitting on the ground, and just keep working on bringing yourself back into that neutral posture. I hope that helps, and let me know if you've got any questions.